Aging is tied to numerous health concerns, and poor sleep can contribute to many of these problems, reducing the quality of life for people as they get older. Dr. Veronica Sesi is joining us in studio to talk about the ways these two things relate and also how you can make sure that you are getting better sleep as you age. Thank you for being here with us.
Thank you for having me.
So, what is the correlation there between age and sleep?
So as we age, we see a lot of changes in our sleep architecture. And I know we've talked about sleep before and how we have an internal clock, basically our circadian rhythm. What happens is with aging, we don't have a reduction in the amount of sleep we need, but we unfortunately have a reduction in the amount of sleep we typically get. We tend to have more of our lighter stages of sleep and less of our deeper stages. And that occurs for several reasons. We have changes in our hormone regulation, we have a reduction in melatonin, and areas that control that circadian rhythm basically have destruction over time. So we see changes as a result in that can result in reduced efficiency of sleep, frequent awakenings, increased need for napping, and various other conditions that are common.
Okay, I'm assuming this varies person to person, but on average, when would a person start to maybe see some of these issues?
Usually around 65. So we'll see about 50% of elderly patients complain of sleep issues. About 30 to 70% have chronic sleep issues.
Okay, so if you are someone who's dealing with that, what are some of the steps that you can take to try to fix it?
So it's important to identify what the specific issue is. So it's normal for us to wake up a little bit more as we're older because of that reduction in our deep sleep. So you don't want to be alarmed if you are having some of these difficulties. The problem typically arises if you're having trouble during the day or if you're having trouble staying asleep. So it's very common to have advancing in our sleep phase. So going to bed earlier, waking up earlier. Very common to have more insomnia tied in with a lot of other conditions, whether it's medications, medical conditions. We see more anxiety, depression in the elderly population, of course, and social isolation, which contributes to that too. We can see an increase in napping as well, which is not necessarily problematic. Naps can be refreshing and restorative, but the problem arises more if you're doing them too late and too long, or if it's compensating for significant disruption at night.
Yeah, we know that sleep issues are something that happen to people of all ages.
Yes.
Are there any clear signs that you can spot to identify that this could be something connected to aging?
So typically, again, conditions like the advanced sleep phase, we have with aging increased risk of things like sleep apnea, restless legs, and insomnia. So as far as if it's pathological and something where you should seek treatment, it really depends on how much disruption is causing at night as well as how much it's affecting you during the day. Keep in mind too, that disruption of sleep and that dysregulation can cause a lot of cognitive issues, which are more prominent in the elderly. Increased risk of falls, so insomnia alone is an independent risk factor for falls, even without the use of a sleep aid or chronic conditions that can cause falls.
And lastly, let's just talk about the importance of getting enough sleep for all ages.
All ages, we're looking at typically 7 to 9 hours is really what is recommended, and that helps with clearing the toxins from the brain. Sleep is restorative, it's restful for people, and basically helps you function at your peak. Helps improve our ability to focus, concentrate. Growth hormones are secreted during sleep, so it helps with growth and development and can really help with performance in different ways, whether it's physical performance, mental performance. It's also tied in lack of sleep with a lot of medical conditions, cardiac disease, cognitive issues, pulmonary disorders, so many different things that we can see with disruption of sleep.
All right. Dr. Veronica Sesi, thank you for your time and your insight.
Thank you for having me. Thank you.